Meanwhile, 12 children below the age of 10 have been infected in Karnataka. A 10-year-old girl child has tested positive for COVID-19 in Kalaburagi. A 10-year-old child has been infected by patient 177. The Karnataka Health Department is working to decrease the infection among children. Health Minister Sriramulu has said that officials are discussing ways to protect children. But there are 12 children below the age of 12 who have tested positive for COVID-19, and these are all cases where the children had come in contact with those who are positive, their parents, relatives who had tested positive for COVID-19. The quarantine period has increased from 14 days to 28 days. Sriramulu as well issuing the clarification. Yesterday, the Education Minister Suresh Kumar had also said that since there are cases, more number of cases coming to light, the quarantine period will be increased from 14 days to 28 days. Let's go across to my colleague Amrita, who joins us live from the newsroom with more details on this. Well, Amrita, the elderly and children are the most susceptible, and they are at a higher risk if they contract COVID-19, which is why the news of 12 children below the age of 10 being infected with COVID-19 comes as some grim news in Karnataka. Of course, there has been glimmer of hope as well in Dakshin Kannada in particular. As we remember, an infant has also now tested positive after the infant had previously tested positive. Take us through the details and the challenges for the health department officials.
So Pratibha, right now the challenges before the state government is also one, those with the SARI cases and also the children who are, exposed to this kind of virus. And if we are to talk about the particular child, 10-year-old child who has been infected in Kalaburagi today, whose reports have come out today, that particular child was infected by patient number 177, who again was categorized under severe acute respiratory infection. So over here in the latest times, we have seen several children also being infected with COVID-19 due to some of their family members also getting infected of COVID-19. So this has put the health of several children under risk, and children are also categorized under the vulnerable category as per the guidelines set by the center itself. So right now the State Health Department is also coming up with several plans to decrease the number of infection cases among children. Just recently, the Health Minister Sriramulu spoke to us, and he told us that the health department officials are discussing ways to decrease the infection cases among children. They are coming up with plans. They are trying to spread awareness among families, and especially the adults who have had a travel history or to make sure that their children and also those senior citizens and people with comorbid conditions remain safe from these people who've had a travel history recently. So this is all the things that the health department is now looking into. So far, as we all know, the Karnataka state has 12 children under the age of 10 getting infected with COVID-19. But that being said, the numbers are also larger when it comes to children above 10 years of age also getting infected with COVID-19. Lately, from several places, we had seen even a 13-year-old child, 11-year-old child getting infected with COVID-19, especially coming in contact with their parents or with their, guardians. This is the, primary contact they've had. So this is a very big concern for the state government, as the number of cases among children also is rising steadily, Pratibha.
All right. Well, many thanks, Amrita, for joining us with those details. So the State Health Minister has also addressed this concern by the health department officials. The total number of children below the age of 10 years who have contracted COVID-19 has increased to 12 now. Meanwhile, all roads leading to Tipu, Nagar have been shut after an elderly man died due to COVID-19. The health officials have already identified 77 primary contacts. 60 primary contacts have been shifted to the hospital. So 77 contacts have been identified by the health department officials. They have now traced down these contacts who are being monitored. But now it has also been identified as a high-risk zone because of so many contacts, the primary contacts of the patient who tested positive.